Welcome to the Mayo Clinic Human Optimization Project, where we're creating the blueprint to help you become the best human you can be so you can give your gifts back to the world. I'm your guide and fellow optimizer, Christopher Camp. It's been said that we are what we eat, and we all sort of understand what that means. At the same time, we also understand what it's like to intermittently experience body aches and pains that we can't always explain. So while the reason for these aches and pains are variable, much of this pain and inflammation we experience may be related to the food we eat and the beverages we drink. So are you curious if that's the case for you? Our session today is titled How Diet and Nutrition Impact Pain and Inflammation in the Body. And our expert guest today is Chelsea Hoffman. Chelsea is a dual-credentialed registered dietitian and physician assistant specializing in pain medicine within the Department of Anesthesiology at Mayo Clinic. She serves as an assistant professor of anesthesia and medical education. She's a sought-after speaker who presents regularly at Mayo Clinic and at regional and national conferences, sharing insights on pain management, nutrition, well-being, and education. Her passion lies at the intersection of nutrition and pain, and she's going to help us work through this universally applicable topic today. And the three big questions that we're going to tackle with Chelsea today are, number one, how does our nutrition impact pain and inflammation in the body? Number two, what are the foods that are the biggest problems for us and why do we keep eating them? And then number three, we'll get into some solutions in the third section when we ask her, what practical changes can we make to our nutrition to reduce pain and inflammation to leave us feeling like our best selves? Well, Chelsea, thank you so much for joining us on the project. Really excited to talk through this with you today.
Yeah, thank you so much for having me. I'm really excited to be here.
Good. Let's start with some defining some terms that I think people kind of understand, but they're a little bit complicated and can be a little bit different with some overlap. So as an expert in this area, how do you define pain and inflammation? Are those things the same or are they different?
So they're different but related. And so let's start with the definition of pain. So pain is defined as an unpleasant sensory or emotional experience associated with or resembling that which is associated with actual or perceived tissue damage. And that's really the agreed upon scientific definition of pain, but I find that to be a little bit confusing or muddled. And so when I break it down conceptually for people, I say pain has an emotional element, a physical element, a mental element, and really it can be associated with true underlying tissue damage, but it doesn't have to be. Mm-hmm. We can further subdefine or subcategorize pain based upon how long it has been present for. So for example, acute, meaning relatively recent onset pain, subacute, which is kind of this gray zone, and then chronic, which is fairly well agreed upon that chronic pain is pain that's been present for 3 months or longer.
Okay.
And we could also break pain down based upon the mechanism or the nature of the pain. Mm-hmm. So defining pain can be really complicated.
Yes.
And then you throw inflammation in there. And I'd like to point out, so inflammation in the short term can be our friend. It's physiologic, it's adaptive, it's how we fight off viruses or bacteria. When we get a cut or a scrape, maybe we protect that area. It might get warm or swollen or tender. And those are all signs of physiologic healing that's occurring and an acute inflammatory response. But as inflammation lingers on, it can become chronic and maladaptive. And that's really where we see pain and chronic inflammation starting to go hand in hand and becoming problematic.
Oh, that was excellent. So you gave us a great definition, not only sort of the etiology of these, where they're coming from, the fact that there are different components with the emotional, the physical, the mental, and also the linkage. And I agree, there are some benefits to both pain and inflammation. Yes. At times, but also too much can be a bad thing. So I think for our discussion today, correct me if I'm wrong here, but we're going to focus mostly on the part where both pain and inflammation sort of have that negative physical component to it, right? It makes us, it's the physical sensation that we don't want.
Absolutely.
That's what we're going to be referring to today. Is that easy to say in simple layman's terms?
Yes, I agree with you.
Awesome. Okay. So Now that we're sort of outlined that, we know we're going to talk about this in relation to our nutrition, but maybe really quickly, can you outline just a few other sort of non-nutrition factors that contribute to how much inflammation we experience in our bodies? It's not all due to diet, right?
Yeah, I'm glad that you asked that. So it's really hard to tease out what is coming from nutrition alone and what's coming from other confounding variables. And so when we look at those pillars of lifestyle medicine, we know that inflammation can be impacted by other things such as our stress level, the amount of quality sleep that we're getting, how much exercise we're performing, and then that nutrition component as well. And so it's really hard to tease out what's coming from what. They're all connected.
Yeah. So in order to nail this, we really have to try to address all of those different areas of our lives, which I think can be overwhelming and challenging.
Absolutely.
But I do think it's wise for us to sort of take it one step at a time. So today we'll talk about the nutritional contributions to that. But in the background, I think it's important for our listeners to keep in mind that this is not the fix for everything inflammation related in their lives, and that we do also have to address the exercise, the stress, the sleep, and those other things that we talk about. Okay, so now let's talk about the nutrition and how nutrition relates to inflammation and pain. So what's the connection there? So how does the food that we're ingesting and putting into our mouth then lead to this abnormal or painful, negative experienced inflammation in our bodies?
Yeah. So it's actually pretty fascinating. So we ingest the food, it's broken down, right? And they have done multiple studies over the past several decades, if not even prior to that. And we can directly measure the impact in terms of that broken down food as we've digested it, and these pro-inflammatory mediators within our bodies. And so we have lab values, we have tissue specimens where we are able to directly correlate those foods to an inflammatory effect. And so we know there's a direct impact.
So everything is sort of a chemical reaction, right? Like everything we put in our body and do to our body causes some sort of downstream chemical and biological reactions and responses, many of which are good and necessary and critical for life, some of which work against us. And food is no different. It sort of starts this cascade of these biological and chemical reactions that then increase the inflammatory markers.
Yes.
Okay, so how big, like what's the effect size here? How big of an impact does nutrition-related inflammation have on our day-to-day lives?
Yeah. So I think it has more of an impact than what we realize. And sometimes it's not until someone has made a change and has objectively tracked functional metrics in terms of how has their sleep improved, how has their mood improved, their energy level, that they can really appreciate how big of a difference that it makes. So you have to start somewhere. But again, we talked about how these lifestyle factors are intimately connected. And so you have to start somewhere. You have to make a change and see once then what is that trickle down or downstream effect.
Absolutely. And we're talking about these downstream effects can be different. There's some variability. So some of us, we know, as you talked earlier, there are types of sort of severe chronic pain that people are dealing with that's really disabling, that requires medical help, medications, massive plans for pain treatment. But there's also sort of just the general aches and pains, like, oh, this hurts. Why does that hurt? What is going on? How much of those like general daily aches and pains do you think are coming from the foods that we're eating?
Yeah, so complicated question in some ways, even though it sounds straightforward. So I think on the one hand, as we age, it's very common to have random aches and pains. And some of that's based on what activity did we do the day prior? Were we doing a bunch of heavy lifting? Oh, now our back kind of hurts. Maybe we slept wrong and now our neck feels like it's tweaked. Oftentimes people are able to identify what the triggering event was that then led to that ache or pain the next day in terms of, age-related aches and pains. Now, when we're talking about nutrition and inflammation, what I see in patients suffering from chronically painful conditions is it's more kind of this vague, generalized, it might be more widespread aches and pains that we really can't pinpoint to some specific event or activity that they did that brought it on. They just don't feel well. They don't feel feel like themselves and have their normal energy or mood. And so again, it's impacting a lot of things.
And I think it's almost like weight gain, where if it happens slowly and gradually over time, you might not really notice it as it builds up. And then all of a sudden you're just like, wow, I'm really sore. Like, what has been going on with me? I don't feel like I did 2 years ago, which is very different than if, oh yeah, I started doing squats in the gym yesterday and now my legs hurt today. Like it's very clearly to easily connect those in my mind when I have that acute increase in pain or inflammation. But sometimes I think this sort of inflammation that builds up due to our diet and nutrition builds up over time.
Yeah.
And we slowly sort of adapt to it. We don't realize how much we're hurting until we do something about it.
Yeah, I agree.
Okay, so can you explain this term to me, anti-inflammatory diet? This one's been a little tougher to understand. Some diets, all sorts of diets that are out there, with pros and cons to each. Some of them are easy to understand because they're clearly defined by, you add this one type of food or you eliminate this one type of food, or it's based on the timing that you eat, et cetera. They have very clear definitions. The concept of an anti-inflammatory diet is a little less clear.
Yeah.
So can you tell us what that means and what people refer to when they're talking about that?
Absolutely. So an anti-inflammatory diet is more of like an umbrella term. That's how I think of it. And yes, there are certain dietary indexes out there where you can take a look at a specific food item and how high of an inflammatory response it has been associated with in the body. But most people don't want to look up every single food item that they eat. And so I find it more helpful to talk to patients about sort of a modified nutrition pyramid for patients who are suffering from chronic pain and inflammation. And at the base of that pyramid is going to be the overall dietary pattern. And that's what matters the most, what people are doing day in and day out. And so what is an overall anti-inflammatory pattern of eating? That's going to be something like the Mediterranean diet, or here at Mayo Clinic, we have the Mayo Clinic diet. Both of those are really grounded in principles of anti-inflammation in terms of what they're prescribing as far as the food groups that you eat, how often you're eating those various food groups. Now, once somebody has their overall dietary pattern dialed in, we certainly can go ahead and talk about specific foods, macro or micronutrients, or perhaps even later talk about supplementation. But I don't even go there with folks until that overall dietary pattern is really dialed in.
Okay, perfect. So in our next section, we'll actually go through a bunch of foods and kind of break them down. Is this a pro-inflammatory food or an anti-inflammatory food? So we'll list off a bunch of those, which I think will help, and we'll put that in the context of the Mediterranean or the Mayo Clinic diet. Another question I have, and I think this is really confusing out there right now, is how can I tell if the pain and inflammation I'm having is coming from food and I need to work on it? And the reason I ask this is because now we see all these ads for these different blood tests that people are pushing out there, and you can check all of these different biomarkers and things like that. So do people need to be getting these blood tests in order to understand whether or not they have increased inflammation from their diet?
That's a great question. So yes, there are those biomarkers of inflammation that we can measure, and we do in scientific studies. So like we talked about earlier, so that we can directly measure the inflammatory effect of certain foods and what that looks like then in our bodies. But for the general population, we don't need to be doing that. I think it's more helpful to have objective, functional metrics that we're looking at. And so it starts with making a dietary change and then taking a look at, okay, now that I'm tracking after I've made this change, how is my sleep? How is my mood? How is my energy level? All of those things. And so I'd rather see patients come back to me reporting on those so we know if we've made a change towards the positive.
I think that's really helpful because we have to remember the ultimate goal for this is general health and well-being and happiness and joy and living a life that you really want to live and are happy with.
Absolutely.
It's not necessarily just fixing a bunch of blood tests and blood markers.
Yes.
So I do worry that if I think all of the blood tests, they certainly have their roles and they're important, and you outlined a bunch of those, but we're not just chasing numbers and blood tests here. We're ultimately trying to make people feel better and be their best selves.
Yeah, and I think we also need to recognize that there's other factors that can impact those lab values or those biomarkers. So, for example, if you have been sick with a recent illness, if you're under a lot of stress, if you're not sleeping well, those things can also impact some of those inflammatory markers. They can fluctuate. And so that might not be the best way that we can track these nutritional changes that we're making.
Perfect. So maybe to our audience, I would say, I think those tests can be really helpful, but you have to understand the context, everything that can be contributing, and then ultimately realize that your ultimate goal is to feel good and to feel better. So they probably have their place, but they're not the end-all, be-all.
Agreed.
Okay, so let's jump into our second section here where we're going to talk about what foods are sort of the biggest problems for us and why we keep eating them, despite the fact that they're problems. So first I want to ask, as a society, how are we doing on this? So how are we doing with our anti-inflammatory diet, and what grade would you give us?
Yeah. Well, the American College of Lifestyle Medicine has told us that a poor overall dietary quality is one of the leading contributors to premature death in Americans. And in 2024, statistics showed that well over half of our United States population was consuming a pro-inflammatory diet.
Okay.
So if you combine those two, I'm probably being overly optimistic if I give us a grade C.
Okay.
I would say maybe a D.
Yeah.
We have some work to do.
Yeah. And that's you're saying diet is the number one contributor to our mortality, not like our lifespan and death rates, but it's also contributing to our quality of life along the way.
Exactly.
So diet is a massive lever for us. And we talk about high leverage items on this podcast all the time because most of us don't have the bandwidth to be working in the margin. So we want to focus on the high leverage things where we can make some changes that have a really big impact on our life. And this is probably one of the biggest.
It's massive. And I think in the context of our podcast today, we're talking about nutrition, chronic pain, and inflammation. But what we need to recognize that this nutrition and inflammation is underlying some of the main reasons that individuals go in to seek care from their primary care provider or from their family medicine clinician. Cardiovascular disease, diabetes, pre-obesity and obesity, metabolic syndrome. I mean, we could go on. And so it's a massive issue.
So we're talking about dietary changes and implications based on pain and inflammation specifically today.
Yeah.
But it's important to keep in mind that these changes we're talking about will also impact all of these other things in a positive way. They're going to reduce our diabetes, heart disease, weight-related issues, and everything else.
All for the better.
Okay, so now let's break it down. Let's talk about what foods are the biggest problems for us. So maybe it's best, can we break it down? We'll talk about maybe the pro-inflammatory foods that we should be avoiding, and then we can talk about maybe anti-inflammatory foods that we should probably consume more of. Is that okay?
That's great.
All right, so start with the bad stuff. What are the pro-inflammatory foods? Is there a clear framework or structure for thinking about this?
I'm going to give you sort of a grouping of the most common pro-inflammatory foods that are culprits in our modern day diet, and recognizing that each of these has a direct effect on inflammatory markers. So things like saturated fat in our diets, oftentimes that's coming from red and processed meats. Trans fats, which the United States Food and Drug Administration really has banned these in our food supply, but they're sometimes still hidden in commercially available processed or packaged foods, baked goods. So you might see those still hidden in there. So it's really important to take a look at the labels. Of course, added sugars, and oftentimes we're seeing those in sugar-sweetened beverages.
Mm-hmm.
Those would be some of the main ones right off the top.
And what about really refined carbohydrates too, like the baked goods and the cookies and the donuts and that type of stuff?
Yeah, so I would sort of lump some of those things into like ultra-processed foods.
Okay.
They're not anywhere near what their original form was. They have been changed in many different ways, and they're made to be sort of hyper-palatable. Our taste buds crave them because of the combination of salt and sugar that they put in there.
Okay, perfect. So the saturated fats in red meats and processed food, trans fats, which fortunately are banned but still sneak into certain things, added sugars, which commonly show up in sweetened beverages,
Yep.
and then ultra-processed foods, which are fairly ubiquitous.
Yes.
We see those everywhere, and that's going to be the packaged stuff and the super sweet baked goods and a lot of desserts and things like that.
Yes.
Okay, great. And so now let's do the flip side. I know that there's all sorts of different scales and grading systems on how you measure the inflammatory contributions of food. But can you give us the flip side of the things that are anti-inflammatory or that are going to reduce inflammation in our diet?
Sure. So, being consistent with a Mediterranean style of eating, the Mayo Clinic diet, or if we're looking at those dietary inflammatory indexes, across the board, they're all going to agree that fresh fruits and vegetables, the more of those that we consume each day, the better. If you're going to use oil in your cooking, using a heart-healthy oil like olive oil is ideal. If you are consuming animal protein, lean cuts of protein such as white meat like chicken or turkey, seafood so that we can get our omega-3 fatty acids, which have anti-inflammatory effects. And then other things, if you're going to consume dairy, making sure that it's low-fat dairy because dairy does have saturated fat in it as well. You already talked about the whole grains and making sure that we're not having refined grains. And so part of that's looking at the nutrition label and making sure that it says 100% whole grain as the first ingredient on there.
Let's talk real quick.
Yeah.
Why don't we I think it's worth spending a minute on this. Let's talk a little bit about the difference between whole grains and refined grains.
Yeah.
What are those? And maybe give us some examples of each for people. So whole grains, that's what we should be looking for.
Yeah.
The refined stuff, that's what we need to stay away from. Can you kind of explain the difference?
Absolutely.
So examples of whole grains would be things like wheat, oats, quinoa, and rice. These are higher in fiber, vitamins, and minerals, as well as antioxidants. And the difference between whole grains and refined grains is that in whole grains, each grain consists of the hard outer coating, which is called the bran, the germ, which is the part that sprouts into a new plant, and the endosperm, which is the energy supply for the seed. In refined grains, both the germ and the bran have been removed, and this allows for a finer texture and a longer storage life. So refined grains you'll find in things like white breads, pastries, cakes, and crackers. But on the daily, we really want at least half or more of our servings of grains to be whole grains.
And the benefit to the whole grain is that it's less processed.
Yes.
It still contains the fiber with it, which is good for a lot of reasons, but it sort of slows the digestion, the processing, and all of that.
Yep.
Whereas the refined grains have already been broken down and that sort of fiber has been removed or extracted and is less valuable.
Yep. Yeah, so you're right. So not only is it stripping it of nutrients, which then typically have to be added back into those refined grains, but you're also losing that fiber, which not only is good for digestion, but fiber is also anti-inflammatory as well.
Right.
Yeah.
Okay, perfect. So anything else to add to the big list of anti-inflammatory foods?
So again, if we go back to the Mediterranean style of eating, I would want to add things like lentils, legumes, beans. Those could all be on there.
Mm-hmm.
Another great heart-healthy option is consuming nuts. And so I always have to clarify, I'm not talking about a big fistful of nuts, but if you cup your hand, that small indentation there is a serving of nuts. And that's a great heart-healthy, minimally processed snack that people can have too.
Okay, so in my notes on the anti-inflammatory side, fruits, vegetables, olive oil, lean white meats like chicken and turkey, fish and seafood, low-fat dairy, whole grains, legumes, beans, lentils, and nuts.
That's great.
And that's, in essence, that kind of is the Mediterranean diet and the Mayo Clinic diet are sort of built around those things.
Yes.
Okay, all right, fantastic. So now my next question, a little controversial, alcohol. We used to think alcohol all bad. Then we say, well, maybe there is some heart benefits. Now we're saying, maybe there's not. There is some cancer risk. There's a lot associated with alcohol. What about from an inflammatory standpoint? Is there any data to suggest one way or the other that alcohol is pro-inflammatory or anti-inflammatory?
I like the way that you asked that question. So if we're specifically looking at this from an inflammation perspective, according to about 17 different dietary indexes that are out there, they would rank wine as being less inflammatory as compared to things like beer or other types of alcohol. However, there's a plethora of studies out there that, depending upon how long the alcohol has been being used for or consumed, whether or not that's kind of wreaking havoc on our bodies in terms of inflammation and damaging effects.
So like most of the other studies, probably best to minimize.
Absolutely.
Minimize or eliminate. I think more of the data is showing us that's probably going to be the best approach from a health standpoint.
Yeah. And the thing that I have trouble with too is that right now with our overweight and obesity epidemic that we are in, the last thing that Americans need are empty calories. And that's exactly what alcohol is.
Yeah. So that's a great segue to my next question is these food, like if you look at the foods that you had on the pro-inflammatory list, one of the other issues, not only those cause increased inflammation, they also cause weight gain.
Yes.
And increased weight is also going to add to generalized aches, pains, and inflammation. And adipose tissue or fat tissue can be very pro-inflammatory. So is some of the impact of these pro-inflammatory foods are from the foods themselves. Some of it may be from the weight gain that they cause. Do we have any idea how much is coming from the excess weight we're carrying versus the pro-inflammatory nature of the foods we're eating?
I think it's really hard to tease that out. Like you said, when we have an overweight or obese individual, they're carrying more weight on their skeletal frame than it was meant to carry. So we're seeing degenerative joint conditions earlier and earlier than we ever have before. Hips, knees, you name it. And those are painful. But on the other hand, those people can still be kind of suffering from some of those widespread aches and pains that we can't attribute to a specific joint. And sometimes that's because they're in this sort of metabolic syndrome and inflammation is wrapped up within that. And certainly it's coming from these pro-inflammatory foods that they're eating as well as the excess weight that they have. So it's really connected.
So it's kind of working through multiple mechanisms to increase pain and inflammation in the body. So,
yes.
Which can be discouraging if you're somebody out there who's been struggling with your weight, but also think encouraging to think, well, if you can make some of these changes, you may start feeling better even before the weight comes off just because of some of the anti-inflammatory benefits. So this can be kind of a 2-for-1 and that
yes.
you're going to have less inflammation going into the body. And then if weight comes off, you may have less pain for that.
Exactly.
All right. Another question I have is how does age play a role in this? Because it seems like our kids, can knock down a bucket full of Halloween candy and they're still running around feeling fine. I do that and I'm feeling terrible. So does age play a difference in how food affects us from an inflammatory standpoint?
When I think about the evidence that's out there, most of the studies done on nutrition, chronic pain, and inflammation are done in adult subjects, age 18 and older. So we don't have as much evidence in the pediatric population on nutrition and inflammation. But I agree with you. I think all of us can attest to the fact that as we've aged, we're less able to sort of bounce back from some of these things like eating a bunch of candy or having a poor night's sleep. I think some of that is multifactorial. As we age, we have increased life stressors associated with work, associated with caregiver responsibilities, maybe for a spouse, a loved one that's aging, taking care of our children, our work, our finances. And so it's so incredibly compounded. And I think all of that plays into this.
Yeah, I think it's one of those areas too where you think, well, I'm young. I can get away with this, but should I? And I think part of it too, one of the other important things is we start to form these, connections and neural pathways early in our life too. So we're starting to develop some of those habits early on. So even if a child or us and our younger selves, in our 20s, maybe we think we could handle it, it's probably important for us to start to develop the healthy habits early on, because then that's going to make it easier for us when this gets a lot harder as we start to age too. So even if we don't have the direct feeling of pain and inflammation in our early 20s, we might be starting a habit that leads to pain and inflammation later in life. So I think the habit formation part of it is pretty important for our younger listeners to consider, even if they think that they don't have, a lot of pain secondary to their nutritional choices.
I agree with you. And role modeling too, right? For those of us that have younger folks around us or kids that are around us, they're paying attention to what we're doing.
Yes.
And so we want to set them up for success, especially because our country right now is struggling so greatly with this problem.
Yeah, great point. And the data on sort of childhood obesity and childhood-related nutritional illness is very concerning.
Yeah, it is.
And that continues to grow and get worse and worse. So I think it probably is playing more of a role than a lot of us realize. Okay, so let's jump into our third section where we're going to talk about some practical strategies to hopefully help us get better at this. So as we do that, one of the strategies that I know a lot of people jump to is supplements.
Yeah.
Right? We all want the quick fix. We want the hack. I don't want to make any major changes. I just want to be able to take this pill and get rid of this pain and inflammation. So are there any supplements out there as we think about what we're going to do? Are there supplements that we need to be thinking about taking or adding to try to reduce the chronic pain and inflammation?
Before I answer the supplement piece of it, I'm going to take all of us back because remember at the beginning we talked about the nutrition pyramid for chronic pain and inflammation, and the base or the foundation of that pyramid is the overall dietary pattern. So before I even talk about supplements with anyone, I really want to emphasize that I'm a food first approach. So we're going to talk about that dietary pattern, maybe some specific foods or micronutrients, and then we can talk about supplements once we know that we're doing really well in those other areas. To the question about supplements are not benign. They have risks with them too. And so recommending supplements has to be done in a very personalized and careful manner. We need to check and make sure that there's not any drug-drug interactions with other medications that patients or individuals might be taking. Anticoagulants or blood thinners is a great example. There's some supplements that don't play nice with blood thinners. So really being mindful of that and what other medical conditions someone has, how their liver's doing, how their kidney's doing. When we're talking about supplements for chronic pain and inflammation, I usually try to break it down into two different categories to kind of conceptually make sense of them. And so one is musculoskeletal pain, one is nerve pain. Mm-hmm. And so for musculoskeletal pain, so kind of joints, ligaments, tendons, tissues is what I'm thinking about in that category. There's pretty good evidence for things like collagen, turmeric, glucosamine chondroitin. Those are a few right off the top of my head. On the nerve pain side of it, alpha-lipoic acid or acetyl L-carnitine are a few that have been found to be helpful for nerve pain, and specifically, mostly for diabetic peripheral neuropathy or painful diabetic peripheral neuropathy is really where the studies show the most evidence.
Okay, so to summarize that, tell me if I'm hearing you correctly. Dietary pattern is number one priority.
Yes.
Just because that's going to have a much bigger impact and a larger impact than supplements will. Mm-hmm. So that's probably where your emphasis should be first. When you get that dialed in, supplementation worth considering, mm-hmm. but you have to be thoughtful about it. Mm-hmm. And from what I'm hearing from you, there is no one supplement out there that we should all be taking universally that helps with this. No. You got to think about it case by case. Okay. And think about why you're taking it and maybe a different set of options for somebody who's doing it for musculoskeletal pain versus neuropathic pain. You got to think about everything else you're taking and potential interactions, which I think is important. Okay. So one of the reasons I think we all tend to steer towards these pro-inflammatory foods, which tend to be the refined stuff, the processed stuff, is that we often think they're cheaper, they're easier to access and carry with us, and they taste good. Mm-hmm. And so for that reason, I think, addiction is a big part of this. Convenience is a big part of this. And so those things are really hard to overcome and move past. Mm-hmm. So if somebody's out there thinking, okay, I want to switch, but it's going to be really tough because, these other things are so easy. Have you been able to see people make real lasting changes in this area?
Yeah, I have. And usually people will pick somewhere to start. You have to pick somewhere to start. So perhaps it's that they're cutting out sweetened beverages as the first thing. That's an easy place for some people to start. So that's one example. Maybe a different example is that instead of bringing a processed or packaged item for a snack, they're bringing a piece of whole fruit or some baby carrots, something like that. Or we talked about a small handful of nuts. So those are all whole foods that you can bring for snacks. It's an easy change. What I find is that once people have had a little bit of a washout period, you almost have to like retrain your taste buds. Your taste buds get so accustomed to these ultra processed, hyper palatable foods that have been chemically modified with artificial sweeteners and salt, you forget what a piece of fruit tastes like. We forget, and our taste buds forget how sweet that item actually is. And once people have had that washout period and some time to readjust, they'll come back and tell me, oh my gosh, I forgot how good strawberries are. I can't believe what an apple tastes like. I'm able to taste all these things now that before they felt really dull or toned down to me. And so it's actually pretty amazing, that change.
How long is that washout period for people?
I think it's going to depend upon the person and how many processed foods they've been consuming. Probably a few weeks.
Yeah. So stick with it a few weeks
Yes.
and then see, and you may have a new appreciation for that apple, banana, strawberry, or whatever it is. Yeah. So be on the lookout for that. Okay. So now let's talk about how we're actually going to change it. And, I've seen you talk and speak on this before, and I think it'd be helpful for us when we talk about change. Let's break this up into two categories. So let's talk about sort of the mindset around this. And then second, we'll talk about the actual behaviors we're going to do. So help us get in the right frame of mind. So if we're going to make these changes, what are some key components from a mindset standpoint that we need to be thinking about to set us up for success?
So in pain medicine, we're big fans of setting goals with patients and finding out what's important to them. And so for some people, it's that, they want to be able to play basketball in the driveway with their kid or their grandchild. It might be something as simple as that. They want to be able to hold their grandchild on their lap, lift a kid, whatever the case might be. And so what's important to them? What is that goal? And can we then link our SMART goals back to this value that they have, this goal that they have in mind? And so I use that SMART goals framework. I want to work with them on a change that's going to be very specific. So we're going to specifically state, what is the change that we're making? Is it cutting out sugar-sweetened beverages? Is it changing the snacks that we're bringing to work? Is it reading the ingredient label on the food that we're consuming and making sure that we can pronounce and understand what's all in it? Those are very specific. Is it measurable? So that's the M in the SMART goals. Is it measurable? And so can we use a nutrition diary or a food diary, a 24-hour kind of intake assessment, and look, have we met that goal? Is it attainable? Is it realistic in your life? You don't want to pick something that is too far-fetched, because if you fail, you're not going to want to try again. And so picking something that's actually attainable or achievable. And maybe you need that accountability partner to help make this attainable and realistic for you.
So you outlined it as SMART. So the S is specific, M is measurable, the A was attainable. What's the R?
Yeah, so relevant. Is it relevant towards that end goal that we have communicated to each other, whatever that goal was? And then timely. When are we going to reassess this? That's the T. How much time do we need to assess the impact that this change has made? Because we want to come back to it and make sure that we're making progress in the right direction.
Great. I like that framework, and I also like that you started with setting a goal that's important to us. And I noticed your goal was you relate it back to something that's important in your life, right? Your goal wasn't to reduce a laboratory test value or to change a number on a screen somewhere. It's like, how can I make this relevant to my life? How can I go play basketball with my friends or my kid or do whatever? I think that's important. If you understand sort of your why behind doing this, that's going to help you in this process, which I think is a huge part of the mindset. Okay, so kind of define your why of how you're doing this, and then I love that SMART framework: specific, measurable, attainable, relevant, and timely. Awesome. Okay, so that's the mindset piece. Now let's talk a little bit about the behavior piece, which I think is super challenging. I'd say behavior piece probably easier if you get the mindset part right first.
Yes.
And so let's assume we've done that. Now, what are the behavioral components that we need to be considering when we make these changes?
So I would reemphasize with the behavioral side of it, it's so helpful to have an accountability partner. So maybe that's your healthcare provider, maybe that's a registered dietitian, but can that also be a friend, a spouse, a loved one? Can it be your family that's in on this with you? It's so much easier to make a change when you have a community around you supporting you and you're all making that change together. And then from a behavioral standpoint, one of the easiest things to do is just don't bring the items into your home that you don't want to eat, right? If they're not there, if they're not quick and readily available, odds are you're going to take the path of least resistance. You don't want to go out of the home and start searching for those things. You're going to take what's in front of you. So put something in front of you that you want to be eating. So for example, in my house, we always have a fruit bowl on the counter. It's already washed. It's ready to go. There's clementine oranges in there. There's bananas that are sitting out. Maybe there's apples that are pre-washed or berries in the fridge. So we need to steer towards those things. I've heard some people who will get sort of bulk packaged nuts that are healthy because they're cheaper that way, but they'll portion them out. And so then they can just throw one of those portions into their lunchbox, into their backpack. So make these changes easy for yourself. We don't need to make this hard on ourselves. And there you go.
Yeah. Yeah, I think that's really helpful too. Part of it is so much of this is all about habit formation, and we've developed these habits because the food industry has made it easy for us to fall into the habit of eating a lot of the processed stuff for a lot of different reasons. But we can reverse engineer that and make the healthy stuff the easy or the default for us through doing that, which I think is really good. So what are some of the key things we need to target? So you talked about fruit, vegetables, key things to eliminate. That would be sort of quick. You sort of mentioned this already, but what are some big, like high leverage items that you have found it's easiest for people to eliminate out of that pro-inflammatory food category?
Sugar sweetened beverages would be my number one.
Yeah.
So paying attention to what you're drinking. Are you drinking water, unsweetened tea, black coffee, low-fat dairy, milk, whatever? You can knock off hundreds of calories right there just from changing what you are drinking.
Yeah, great.
So that's one of the easiest ones. And then, as I kind of said, the other one would be things that are packaged, turning that package over and taking a look at the ingredients. And if I'm seeing maybe more than 3 to 5 ingredients, I'm asking myself, can I pronounce these? Do I actually know what this is? Does it sound like a chemical? What is that? If I don't know what it is, it probably shouldn't be in my food. And so maybe I'm going to put that back and pick something different. And so those are some quick ones right there.
I like it. So get rid of the sugar beverages, things with more than 3 to 5 ingredients, especially things that you can't pronounce on the label. Okay. Excellent. Well, Chelsea, this has been a great discussion, incredibly helpful. I've taken a lot of notes on this, and I'd like to take a minute just kind of summarize those for the audience, and then I'll give you a chance to answer our 3 big questions once again. So early on, we talked about pain and how it's very complex, multifactorial. There's emotional components, physical components, mental components. We also talked about inflammation, how some inflammation is good, you need it for healing. Too much inflammation, bad, causes pain and irritation. So for today, we're focusing on the excessive and physical pain and inflammation. We talked about how nutrition is not the only contributor to inflammation in our body, but it is a major one. But in order to really get a handle on this, we need to manage stress, we need to exercise, we need to sleep. But nutrition is one of the biggest levers we can pull. As a society, we're not doing a very good job on this. Less than 50% of us are doing, over 50% of us are consuming a pro-inflammatory diet, and diet is the number one contributor to morbidity and mortality in our world today. You listed some pro-inflammatory foods in a big category. So the saturated fats, which are going to be the red meats, processed meats, trans fats, which are mostly banned now. Added sugars, especially in our beverages that we have to watch out for, ultra-processed and packaged foods, and then the refined grains and sweets and things like that. That's what we should minimize. The anti-inflammatory list of things that we should increase: fruits, vegetables, olive oils, lean white meats like chicken and turkey, fish, low-fat dairy, whole grains, legumes, beans, lentils, and nuts in small portions. And then we talked about making changes. And we talked about fixing the mindset first. And I love how you said you really kind of have to tie this to a goal or a purpose that's relevant to your life and important to you. And then you gave us the SMART framework. S is for specific, M for measurable, A attainable, R relevant, T timely. So try to make sure your goals are all of those things. And then in terms of behaviors that we could be thinking about, get an accountability partner group or something to kind of help hold you accountable.
Try not to bring these foods into your house and replace them with healthier snacks. Eliminate the sugary beverages and the added sugar as much as you can. Minimize the processed food. Check labels for things that have more than 5 ingredients. Try to avoid that, and avoid things that have ingredients that you can't pronounce. So those are some small, simple things that I think we can start to do that would really be helpful for us. Now I'll kick it to you and let you summarize by having you give rapid-fire responses to the 3 big questions here. So our first big question, how does our nutrition impact pain and inflammation in the body?
So nutrition has a direct impact on our biomarkers of inflammation in our body, as well as other lifestyle factors, our sleep, our mood, our energy level.
Perfect. This one will be redundant, but I think it's important. What foods are the biggest problems, and why do we keep eating them?
Yeah. So those saturated fats, processed meats, sugar-sweetened beverages, ultra-processed foods that we talked about that aren't in their natural state. And the reason that we keep consuming them is that sometimes they are cheaper and they've hijacked our taste buds. They're hyper-palatable, so they taste good. And so we crave them. We go after them more.
But you gave us some nice tips for getting around those habits and pitfalls in our third section.
Yes.
Our third big question is, what practical changes can we make to our nutrition to reduce pain and inflammation to leave us feeling like our best selves?
Yeah. So first and foremost, following that anti-inflammatory Mediterranean-style pattern of eating, Mayo Clinic diet style of eating, they're all grounded in those anti-inflammatory principles. Focusing on specific foods that you're eating. Don't bring things in the home that you do not want to be eating. And then we talked about looking at nutrition labels. Can you pronounce the ingredients that are on the back? You should start to get a few questions rising in your mind if there's more than about 5 ingredients on there. And cutting out those sugar-sweetened beverages is a great place to start because it's easy and it can knock off a lot of calories right off the bat.
Excellent. So now I always like to end this with a challenge or a call to action for our audience. So I'm going to give multiple options here. I think you've done a great job. You've laid out a bunch of things that people can do, and a lot of people probably already thinking that they know what they're going to do. But what I would encourage folks to do is I'm going to give 2 different options here. One, just take inventory of your current dietary pattern and ask yourself, the food that you're consuming, how much of it falls into that category of the pro-inflammatory foods you mentioned, and then what percentage of it falls into the anti-inflammatory category of foods that you mentioned. And I think that's a great place to start, is just saying, how am I doing overall? You know, what percentage of foods are pro versus anti-inflammatory that I'm currently consuming? So that's one challenge I would ask people to do. The second challenge I really love in that third section, you started out, you talked about how we want to start with the mindset. We need to think about why we want to do this and set goals that are relevant to our lives. The blood test can be really helpful and can be really important, and you want to have, good numbers and all of that. But ultimately think about, what's your purpose for doing this? Is it why do you want to stay active and eliminate this pain and be your best self? Because I think if we can tie it to that, we're much more likely to be successful. So that's my second challenge, is to think about why this is important to you. Why did you listen to this episode? What type of changes you want to make, and what's the driving factor behind it? So those are my challenges to the audience. Chelsea, thank you so much for joining us today. We really appreciate you walking us through this session.
Yeah, thank you so much for having me. It was great.
Good. To our audience, remember to live intentionally, consistently better. Keep striving to be the best human you can be so you can give your gifts back to the world, and never stop optimizing.
Thanks for listening to the Mayo Clinic Human Optimization Project. If you like this episode, hit subscribe and leave a review. It helps others find us. Know someone who might benefit? Share the episode with them to join us in our mission to help as many people as possible become the best humans they can be. Have feedback or a topic idea? Email us at optimize@mayo.edu. And be sure to look for us on Instagram, X, and YouTube.
This podcast is for informational and educational purposes only and should not be relied upon for medical, professional, or legal advice. Always consult with a qualified professional for any questions. The appearance of any guest does not imply an endorsement of them, their employer, or any entity they represent. The views and opinions expressed by the guests are their own and do not necessarily reflect the views of Mayo Clinic. Reference to any product, service, or entity is for informational purposes only and does not constitute an endorsement or recommendation by Mayo Clinic.